Aloha, good morning, everyone. Thank you so much for joining us here on the Facebook page of the Honolulu Star-Advertiser for the COVID Care Conversation, brought to you by the Hawaii Executive Collaborative, which is a consortium of Hawaii business and civic leaders working to make Hawaii a better place. Again, good morning. I'm Yunji Nies.
And I'm Ryan Kalei Tsuji. This is day number 3 of our Facebook Live show. We want to thank all of you for tuning in here. It's kind of, believe it or not, this is Aloha Friday. I had to think these days where you're kind of in these in our lockdown mode, we forget what day it is. So happy Aloha Friday to all of you watching. Also Kuhio Day today. So for those of you who have to work, maybe you actually have today off. It's a holiday as well. We want to encourage all of you who are, those of you who are tuning in right now, let us know where you're watching from. And this, again, is a way for you to stay connected with us, to begin this conversation, to really give some feedback and to really begin to build a community around all the things that are happening here surrounding this COVID-19 pandemic.
Yeah, the operative word of the show is care, COVID care conversation. We care about you. We know that you care about your community. This is a place where you can share resources, talk about what's happening in the news around the pandemic, and also talk about how we can all help each other. So give us a like. Good morning to Ann Rodriguez Ortiz watching us from New Jersey. We want to know where you're watching from. And also you see the scroll right down below. We want to know our topic of the day, since it is a Friday, as Ryan noted. For a lot of folks, Friday is typically payday. And so how are you doing financially? How has the pandemic impacted you financially? We're going to take a deep dive into some of the financial implications of all of this. We'd love to know, how has this affected you already? And we want to say good morning to Rose, Bernadette, Nikki, and Brandon. Thank you so much for watching. Give us a thumbs up. Also share this video because we want to reach as many people as possible. The more you share, the higher it gets boosted. Facebook analytics, I don't totally get them, but we know that if you share and if you like us, it helps us a lot.
Yeah, we mainly just want the message to get out that really this is not necessarily about us trying to get as much views and likes as possible. Really, it's about trying to get this out in the community so that we can provide a service for those in the community. I know that there's a lot of people with questions, and that's what we are here for. We're here to be sort of your resource in this. If you have specific questions, we can work on getting you the answers, and we'll actually message that to you, or we can follow up on the following episode. Again, we are here every day for 2 weeks, so we will help to provide you all the information that you need. So let us know what your questions are. Share your comments. Share this feed and let us know exactly. If you're also watching from the mainland, we want to know. We know a lot of Hawaii transplants are out there watching as well. So we want to say aloha to all of you watching abroad. The first thing we want to do, of course, today is sort of get to some of the hot topics, the headlines here on this Aloha Friday.
Yeah, that's right. The cases right now, as of noon on Thursday, 11 new cases across the islands for a total of 106 positive cases. All but 2 are over the age of 18. So we've had 2 pediatric cases so far. The rest of those are all adults. There have been 7 people hospitalized. The good news is that already 6 have been released. So we're not seeing those long extended stays in the hospital like we've seen in other parts of the country and all over the world. But that does not mean that is not coming. We are seeing the first signs of local transmissions, and health officials like Dr. Bruce Anderson from the Department of Health say that they are expecting a lot more local transmission in the days ahead. What can we do to stop it? Stay at home.
Yeah, and a way to do that, of course, the state entering day number 3 of that statewide sort of shutdown, asking people to work from home. And we saw yesterday for the first time that there were actually citations that were being handed out here on the island of Oahu. We also had a total of 70 citations, but 2 arrests that were made. Police say that a majority of those who were cited were actually beachgoers, people who were on the beach or in the parks. Important to note that while people are allowed to walk out and get a little exercise, the parks themselves are closed.
Yeah, that is really important. And I think there's some confusion because, they are encouraging you for your mental health, of course, to get outside at least 30 minutes, take a walk, get a breath of fresh air. We're so fortunate that we live in such a beautiful place and we don't want to lose that connection with the nature. But that needs to be very limited. It needs to be very careful. If you're walking outside, they tell us, make sure that you're maintaining social distance. They don't want us congregating in parks. The other picture that we wanted to show you comes from Kauai. Kauai has instituted instituted checkpoints. They obviously are a smaller island, so they're able to do things like this. They are trying to limit where people are going. They want to know, are you really running an essential errand, or are you just out going to go see some friends? That's obviously not allowed. So Kauai has checkpoints. So far, authorities on Oahu and the Big Island say that they don't plan to institute those. It's not very practical. An island as big as the Big Island, where I am right now, that they just don't have the manpower. Oahu, there's a lot of roads, but that doesn't mean we won't see them. And Ryan, you've got an interesting firsthand account from someone who did get stopped yesterday.
Yeah, so we heard Honolulu police say, HPD say, that a majority of those citations actually came from parks, but there have been reports of people who actually were pulled over. I know somebody that actually got pulled over in Mililani. He was actually being followed by police for a little bit, arrived at his friend's house, and when police asked him if this was his residence, he said no. They asked what his business was. He said he was just visiting a friend. He was issued a citation for that. And so, they are making sure that people are heeding the order, and just encouraging people to really use caution and really think about, is this essential? What am I doing? Because the police are really making their presence known and really taking a hard line when it comes to these citations.
Yeah, and the fines are no joke, $5,000 and or up to a year in jail. Beyond that, of course, there's the element of personal responsibility. You don't want to be the one spreading this virus. So if you do have questions and you're not sure if you can go out, if you can't go out, what the order is, the city has set up a hotline. We want to tell you about that. It's right there on your screen, 768-CITY. You can call them, you can ask. Also, there's a lot of information about the order at oneoahu.org. So that's a resource for you before you head out the door. If you're not sure, am I allowed to go here? Am I not? Call that number, ask, and when in doubt, I think don't go out.
That's a great resource right there. Call people. We do also know that some of these essential workers actually are getting little placards and permits that they are actually putting on their car. So that is another way the police are really trying to identify who is deemed as essential. We know that there's that list that the mayor and the governor have put out of those who are able to work and able to really drive from point A to point B. That list is pretty expensive, but some of these places are now actually having these placards that people are putting in their car to deem them as an essential worker. So if you do have that placard, make sure you keep it up, because it looks like they're really taking a hard line in trying to enforce this stay-at-home order.
I see some questions coming in, and we love to hear from you. Bernadette Ortega says, when can we expect our COVID-19 stimulus checks? And Ryan's got an update on that.
Yeah, that's right. Let me just pull up that question right there. We do know that that Congress actually passed the CARES Act just moments ago, earlier this morning, and that is a $2 trillion stimulus package, the biggest stimulus package in U.S. modern history. And so some of the updates on that package include those checks that we have heard that will be coming for those people who qualify for this. So what the stimulus package will do is actually it puts cash into the hands of Americans. And so here's a little breakdown. Americans will begin receiving their checks based on their 2019 tax returns. If you did not file those yet, they will be basing off of 2018. A quick breakdown: if you are single and you're making $75,000 or less, you will actually receive a check for $1,200. If you're single and but you are receiving $90,000 and you make $99,000 or more, you will not get a check. Now, a married couple, if you are making $150,000 or less, you will receive a check for $2,400. If you are a married couple and you make $198,000 or more, you will not get a check. Now, parents with children 16 years or younger will get $500 per child, but it phases out again based on your income scale. And also the big thing was the unemployment. With unemployment rates continue to rise, $600 will be added on top of what you're getting from the state, and that will go up for another 4 months. So a pretty comprehensive package in terms of the amount of people that qualify for this. There is a great resource on the Honolulu Star-Advertiser website. There is actually an article that sort of breaks things down, that you can check out to see if you qualify and you should be receiving these checks. When those checks will come in, the Treasury Department is saying they're not really sure. They expect it could be 2 to 3 weeks. It could be longer. A lot will depend on how quickly they can process some of these payments.
Yeah, so we know right here in Hawaii, a lot of you, because we are so reliant on the tourist industry, we're a very different economy than a lot of those on the mainland, have already been impacted. In March alone, right now, we were reading that the Department of Labor and Industrial Relations has reported 67,000 new unemployment filings just for the first half of this week, bringing the March total to over 80,000 claims. That is astounding. We're looking at double-digit unemployment already here in Hawaii, where just a few months ago we were talking around 2%. Not that long ago, Ryan, we were talking about how it was so hard to find workers and how people couldn't keep the restaurant staffed and they couldn't keep certain company staff because there just weren't enough workers. Now, obviously, we have the opposite problem. So again, we go back to our question of the day. Has the COVID-19 pandemic impacted you financially? We'd love to hear from you about how you're doing financially and how this has impacted you. We're going to have a whole show just about filing for unemployment benefits, how that works. We're going to bring on a guest so you can ask your questions directly. That is coming up next week. We'll keep you up to date on that. You're right. Eric says unemployment office is swamped. New claims might have to wait a month. We're going to dive deep on those questions. The other thing we want to remind you on that, don't try to go to the unemployment office in person. They are completely online and on the phone right now. They don't have any operators there in person. Obviously, they don't want to be swamped in person.
That's right. And so they are really just trying to facilitate. There was some concern over the fact that they were overloaded themselves. They actually have brought in a number of other personnel from other departments. They've asked some retirees to come back in to help process, because again, this is unprecedented in terms of the amount and the sheer volume of people that are coming in. I know that the department has also said that they recognize a lot of people here live paycheck to paycheck, and they don't have the luxury of another month to wait for this check to come in. So they are working the processes as quickly as possible. And again, we heard from the federal government that they recognize this as well. Sort of the idea behind this stimulus package is really to just kind of get cash in the hands of Americans so that they can continue to spend money. Some are criticizing it, that they say that this is sort of just a band-aid, that this is that there are longer consequences and people are going to need a lot more support in the long run. Probably the case, but I think right now people just want to make sure that they have some sort of sense of security and knowing when they can receive these checks. So we hope to get those answers for you. Again, as Yunji said, we will be dedicating a segment specifically for this. We hope to have the director of labor here on this show to talk to him and to answer your questions specifically. We'll keep you posted on when that happens.
Now, I know a lot of you are concerned, can you pay your bills? So one of the things, the folks from Hawaiian Electric reached out to us. They want us to get this message to you, which is that Hawaiian Electric has suspended disconnections through at least April 17th. So if you haven't paid your bill, they're not going to cut you off until at least April 17th, but you do have to call them and work out some kind of a payment schedule, because you still will be responsible for the services you used. However, they have also been getting a lot of calls about scammers. So please be careful, whether it's the Board of Water Supply, Hawaiian Electric, any municipality, or really any vendor that reaches out to you. Make sure that really is the person. Hawaiian Electric told us, unfortunately, about an Oahu customer who lost more than $300 after a scammer called, threatened to cut off electricity, and then demanded cash payment through an app. The person paid, and then come to find out that was not Hawaiian Electric on the other side. So just go to hawaiianelectric.com. They've got all of the resources there of how you can call, the payment schedule you can work out. But please be mindful. We know that money is a precious resource, especially right now. Nobody wants to lose $300 to a scammer. So please be careful when you're interacting with people who say they're representing an official agency. They may or may not be.
Yeah, especially if they're asking for payment through a cash app. I mean, that is something that no organization or nobody should be asking, especially if they're providing a service like that. So that is a red flag there. And if you always have questions, please call directly to the company who they're representing to make sure that is accurate. We are, again, thank you to everybody who's commenting and asking us your questions. We're going to try to get to as many people as we can. We have Evelyn here that is asking, I'd like to know how it's going to help cash paid workers. So this is specifically, again, I'm assuming this is in reference to the stimulus package that was passed. There is a provision in the package that actually is tailored directly for those who are more contract workers. So say Uber drivers or 1099 workers, if you are a musician that you get paid, that you're not necessarily a part of a company. There is a provision in there. I think that they are also trying to find ways where you cannot qualify for that. So again, the bill just passed. There is something in there for those cash workers. So we should be getting more information about the stimulus package as it kind of goes through. Again, Congress just approving it this morning. The president still has to sign this into law, though, but he is expected to sign this pretty quickly.
Yeah, and they've got to act fast. A member of the Fed says that nationwide, if this continues, we could see 30% unemployment by June across the country. Just for some perspective, during the Great Depression, peak unemployment was 25%, and they are talking 30%. So the federal government is obviously acting fast. They don't want to see that happen. How does this all relate to you? Those are huge numbers, and they can feel really overwhelming. Well, the best thing that we can do is flatten the curve. The best thing we can do is to stay home so that we don't have to stay sheltered for longer, so that we can eventually go out and work again. I saw one of the questions in there saying, when can we go back to work? That's a great question. The Star-Advertiser's big question of the day, we encourage you to vote in their online poll after this broadcast, says, if the coronavirus crisis calls for a stay-at-home past April 30th, what's your reaction? Fine, you'll handle it. Mixed, not sure if you can do it. And deep hardship you can't handle, whether that's, emotionally, physically, financially, not going to be able to do it. We are in this for the long haul, but we can make it shorter by staying home.
That's right. And again, that is the continuing cry from public officials. We heard state officials actually gathering yesterday as well to provide an update on things that are happening within the state. Not only do they give sort of those counts that we see every day around noon, we get the latest figures, but also what they're planning to do. One of the things that was announced yesterday is how the state is actually preparing for that surge that they say could be coming. They're planning for the worst. They're hoping for the best. But we are seeing it all throughout the country and really throughout the world with some of these hospitals becoming overrun. So the state is actually taking efforts to make sure that they are prepared for that. Again, encouraging people to stay in, but preparing for this to continue to spread, looking at potentially the convention center as well as the Blaisdell Center to become sort of those triage units. They're asking for, considering, I should say, that medical students actually get released early and be able to help in these facilities, as well as bringing back some retirees and those out-of-state workers to assist if those facilities come online. So a lot of insights that happened yesterday during that press conference with the governor and with members of the administration. We also heard from the Army Corps of Engineers, who are really taking the lead on sort of these triage medical facilities should they be needed down the line.
I think Myra has I hope I'm pronouncing your name, Maria, there you go. Maria Grams. Can we go for walks to walk our dog? In California, you're allowed to go out for exercise as long as you keep social distance. But I saw there were arrests this morning just for being outside. Well, we have to be very careful. Of course, you can go outside to walk your dog. I don't think anybody wants to keep you or your dog inside in perpetuity. But you can't congregate in your parks. City parks are closed. The idea is that you go out, you maintain social distance, you let the dog do its business, and then you get back inside. And again, if you have if there is a gray area, if you're worried, you call that city hotline, 1oahu.org or 768-CITY. And again, all the resources that we talk about on this, after the broadcast is finished, I put them in the description of the show notes. So you should be able to come back and I'll link all those resources so that you know exactly what we're talking about if you want to follow up and you didn't have time or if we talk too fast. But yeah, it is stressful. I'm sure that, we don't know, can I go here? Can I go there? And the $5,000 fine or up to a year in jail is very serious. So we do want to take that seriously. But, a brisk walk outside, I think is fine as long as you're not traversing a park, because if you walk through a park, you will get cited.
Yeah, we're getting more comments as well. This one from Mary, beware of fake checks. So not only people asking for money, but I guess fake checks saying that they are from the government. Trump did not sign the bill yet. That's right. We are waiting for him to sign that. Is expected today. A guy from the mainland received a fake check. So yeah, anything that is coming through the mail right now, obviously the government has not approved that. So if there's anything like that, it's unfortunate that these sorts of scams happen, especially in these vulnerable times. But that's when they seem to come out a lot. So you really have to take a second to really make sure that what you are receiving or what you're sending back out is confirmed and it is reputable.
Abraham has a question here. Abraham Akau, what kind of self-medicating ideas do they have? What can we do besides rushing to the doctor? Okay, this is a great question. If you're concerned that you may have symptoms, if you're worried, they don't want you rushing to the ER. They want you to call your primary care provider. If you don't have one or if he or she is busy, Queens Medical Center has a resource there. Their number is 691-2619. And again, I will be putting these in the show notes. They have a nurse on call that you can call, describe your symptoms. If it's appropriate, she or he can write you a prescription over the phone for drive-through testing. So you don't actually need to go into any hospital, and they can direct you on how best to do that. Again, I'll put that in the show notes, 691-2619. The other thing is you can always call 211. That's Aloha United Way. They have trained operators available from 7 in the morning till 10 at night to answer all your COVID-19 questions, including symptoms. So again, that's just 211 on your phone. That is a wonderful thing a wonderful resource to have, whether it's finding out, where you can go, or if you think that you may have some symptoms and you want to get tested.
Yeah, we also, of course, one of the things that a lot of people are doing, continue to do, as we see going into 2 to 3 weeks now. It's hard to keep track of how long we've been doing this, but is some of those panic buying, right? And some of those stocking up. We have a note here from Waxana saying panic buying is ignorance or tremendous fear of the unknown. Also, the best thought of quarantine makes people think that they need necessity for an unknown period of time. So yes, we're seeing a lot of those people who are sort of bulking up and buying. We're seeing longer lines at Costco. They're actually trying to find ways to really have the social distancing implemented within these stores. We heard from Dr. Sarah Park, the state epidemiologist, and she was noting how those things are concerning. We are taking all these efforts to keep people in and social distancing, and yet when they go to places like Costco, all that kind of goes out the window because everyone's just fighting to get toilet paper and water and things that are not necessarily as important. I mean, they're important, but you don't need to panic. It's not like a hurricane. Supplies are continuing to come in, and so they're really concerned about those sorts of things happening at these markets and these big box retailers.
Yeah, and E.M. Evelani Manuel Coates says, what about the test sites? Don't go directly there, question mark. Absolutely do not go directly to a test site until you have been given direction from a medical provider to go there, because we don't want to overwhelm the test sites with people who may or may not need treatment. So the best thing to do, call your primary care provider or call Aloha United Way or call that Queens hotline, which again, we'll put in the show notes. Talk to them before you drive down to the test sites. If you are sick, also, you want to make sure that you're following the correct protocols. So we don't want to send you to a test site where you might infect someone else or send you to an emergency waiting room. We want to, make sure that we are handling this in a very measured way. So talk to a medical provider. Do not drive directly to a test site until you've been directed to do so by a doctor.
Well, we thank you again for everybody that has been kind of sending in their questions. Again, there's a lot of questions in there we'll try to answer. One of the things that we also want to do, besides providing that resource for you, is also to highlight some of the good things that are happening. We know that these are times where we're getting staggering statistics and there's a lot of information coming at you, but there's also a lot of great things that are happening. So we want to highlight some of those people who are doing great things in a community.
Yeah, we're calling them our Hawaii heroes. And here we want to shout out Honolulu EMS. These are the amazing paramedics that help all of us. And they tell us that their 911 call center has been flooded with COVID calls. They're asking, please don't do that unless you do have a medical emergency. Think about your neighbor who might be having a heart attack and needs to reach an operator, or has had a car accident, or is having, a true emergency in that moment. So help us help you. Stay home. That's the biggest message. Hard to believe that for the island of Oahu, which has about 1 million people, they only have 21 ambulances during the day. They have 19 in operation at night. If you think about how big the state is, or how big the island is, that's pretty remarkable. They're spread pretty thin, and when you add something like COVID to the mix, that makes it even more challenging. So please, we want to kokua them and say thank you to them. They're amazing men and women who are putting their lives on the line for all of us. So they are our Hawaii heroes of the day. If you've got a Hawaii hero, let us know, leave a comment. We check these, after the fact. So let us know who you think we should give a shout out to. We want to help get those messages of hope out there too.
And also, we know that there's a lot of people who want to find ways to help. And one way to do that, especially today, we know that there's a large call out right now for masks and a drive for PPE. So they're actually having a drive that's happening today at the Hawaii State Capitol. You can actually go on off Baratania Street by the Father Damien statue and just sort of drop off your supplies there. There is a crew that will be there. Actually, they are there right now from 7 a.m. to 4 p.m. at the Hawaii State Capitol. Great place to sort of drop off any items that you may have. I know a lot of people sort of bought a lot of masks early on when this started happening, and maybe you don't need those anymore, and you can give them to the people that need them the most. One of the important things in fighting this COVID-19 pandemic we're hearing is keeping the front lines healthy and safe. They are the reasons why we need to make sure that we get these supplies to them. So we want to ask and encourage all of you, if you have some of those goods, even if it's just a few, make sure you drop that off today at the Hawaii State Capitol.
Yeah, surgical mask, N95 mask, gloves, just personal protective equipment. Again, those items need to be unused and wrapped. They want to make sure that they're not contaminated. So if you are able to do that, and it's just like a drive-through, you just drive up, drop those supplies and go. They go to the state the state stockpile rather, and then they will get distributed appropriately.
We got
Also, yes, that was just going to highlight
another
that.
one. Dire needs to donate blood, and we know that this is the case. Actually, the Hawaii Blood Bank actually only operating here on Oahu. So Oahu is supplying the rest of the state, and right now they are in dire need. Please make sure that if you are planning to give blood, that you make an appointment. They are also limiting the amount of people that are allowed in the facility at one time because of the social distancing measures. So encourage you, if you are able to and can give blood, please call the Hawaii Blood Bank and make an appointment and go on down there to make a donation. That is a great point. Thank you for sharing that.
Yeah. So again, we want to know, how has the COVID-19 pandemic impacted you financially? Give us a like, share this video, write the response in the comments. The more we can share this resource, the more we continue to have this conversation. Keep on going. We know that a lot of you are concerned about the homeless population. I saw some questions in there. What is being done to help them? And we'd love to hear from you what you think should be done. We're going to devote our entire show tomorrow to that. So we're going to talk about, our homeless population. Of course, Hawaii, has the dubious distinction of often having the highest per capita homeless in the country. And we know that those folks are at risk. So how do we help them? Also, a lot of those folks are children. The Department of Education says 3,000 of their students are homeless students. So what's being done to help those children stay safe, also keeping them educated? And speaking of the Department of Education, just one quick thing. If you have a student in your home and you need a meal, they do have a variety of locations, schools that are open during the week for breakfast and lunch. You can go there and get a meal to go. One important thing that Christina Kishimoto, the superintendent, has pointed out is that you need to have the student actually with you. You can't just go and say, I'm a parent. So the Department of Education website has all the locations. You can go there, get breakfast and lunch. We know that a lot of people depend on those meals during regular times. And now if you are, facing financial hardship, this could be a great resource, and they're trying to ramp that up. Eventually, they say they're going to have locations that are not just schools so that they can reach as many people as possible. But there are those sites available on all of the islands right now. So if you have a student in your home and you need some food, go to the Department of Education website, find whatever is closest to you.
Yeah, we're getting a lot of comments as well about people who want to help out, who say, what are some of the needs? Of course, we talked about some of the masks. Another resource, I actually worked on a website called coronavirushawaii.com. It is a website where we will provide you with all the information that you need about what's happening each and every day, as well as trying to support small businesses. So if you have a small business that you would like to register for on this website, you can actually promote the services that you are providing right there. But the other thing that we have is a section where you can actually sign up to help out during this time. There's a number of organizations that are looking for help, And so you can actually go to that, click on the How I Can Help section, type in your name and information, and we're actually going to pass that along to some of the resources that need it. There's different options where you can pick up the interests that you have, an area that you may want to directly get involved with. So we want to encourage you to go onto the website, again, coronavirushawaii.com, sign up there. We can get that information out to those who are looking for help and support. We also have a link there to Hawaii Community Foundation's Resilience Fund, and that is a fund that's actually going to help the front lines and help some of the people to battle, get resources to the people that are helping to fight this pandemic here locally.
Yeah, we love hearing from all of you. Roxana's got a lot of comments about how to stay safe. I think social distancing is the #1 thing. We're going to talk likely on Sunday, but we'll see, as every day goes on, we see what the needs are. But we really do want to talk about some self-care as well. So we'd love your ideas in terms of the topics that we should be covering. As Ryan said, we're going to be here every day at 10 for at least the next 2 weeks, and we're going to see how it goes. If the response is strong enough, we'll continue this. We want to, because we want to be here for you. But we'd love to know what topics you'd like to hear about, whether it's, self-care, or should we have a medical professional ask a doctor? Do you want to hear about mental health? Of course, we talked about the unemployment resources that we're going to bring on here later next week. So let us know what topics you would like us to cover, because we want to bring those resources to you. And unlike traditional television, this is a two-way street. We see your comments, we can bring them to the experts, we can try to find answers for you. This is really an amazing place where we can go back and forth. Roxana says she's been doing some meditation. If you can calm your mind enough to do it, I think that's wonderful. I have a really hard time with that.
Well, again, we want to thank all of you for tuning in. Again, we will be here tomorrow. It may be Saturday, but we will be here every day for, again, 2 weeks at 10 a.m. We want to encourage you to continue to leave your comments. We will check. We will provide some of the updates and some of the things that were discussed in this show in the notes, so that you can refer back to it with those numbers and with those important links and information. And again, we want to see you back here tomorrow at 10 a.m. and continue to share this and get the word out about this important conversation that we're having here on this Honolulu Star-Advertiser platform.
Yes, we'll see you tomorrow right here at 10. Until then, take care of yourself and stay inside. Aloha.
Aloha.